University of Malta. The need to develop more effective services is self-evident. Changing demography and limited resources mean that manpower issues become increasingly important for the provision of future healthcare. This applies not only to less glamorous areas such as elderly care, but to all areas of medicine. As has been argued, most healthcare planners and members of the medical profession have failed to appreciate the magnitude of worldwide demographic changes and their consequences in relation to the health needs of older people. Most texts on geriatric medicine and nursing subscribe to the need for a multidisciplinary team or interdisciplinary team approach, but many, other than identifying who the members of the team should be, fail to explain how or why such a team may become effective. Let us spend a few moments looking at the development of these exercises in collaboration. Collaboration is a complex activity taking a variety of forms and changing over time. Its purposes are twofold. One, to provide more effective service to the patient-client, and two, to manage staff tensions. It has as its goal the achievement of some degree of consensus by a group of individuals about a plan of action and its execution. It usually includes an interpersonal process in which members of a working group contribute, each from his or her knowledge and skill, to the accomplishment of a task and are responsible as a group for the outcome. The rationale for our participation in collaborative activities is based on the recognition of the complexity of human problems, the high degree of knowledge, technology, and skill needed to meet them, the specialization of function, and the resulting requirements of coordination and integration of the work of the providers on behalf of the patient. Collaborative activity is also valued because it is assumed to be synergistic, that is, the services offered by the group are of greater scope and value than individual contributions separately applied would be. A process of cross-fertilization of ideas is presumed to occur that encourages new perspectives and reformulations of difficult problems and solutions that exceed the boundaries of separate disciplines. Collaborative activities have the potential for both lessening or heightening staff tensions. For some, the need to work in concert with others creates added strains. The more specialized and technical the task, the more difficult it is for the individual to accommodate to the time orientation, work routines, and value systems of other professions. The more generalized the task, and the more the individual professional is dependent on the cooperation of others in its accomplishment, the greater the motivation for collaborative activity. The process of working together creates the need for a method of tension reduction, a medium for resolving the problems that develop when those of diverse education, frames of reference, socialization, value systems, and work styles are required to coordinate their efforts. The culture of the interprofessional collaborative group. Small group theory suggests that those engaged in collaborative activities are likely to develop a group culture, ideology, authority system, division of labor, and set of norms. Although these groups may vary depending on purpose, size, auspice, and participants, the sine qua non of all of them is the development of the value of cooperation and the push towards consensus. Consensus allows for a unified plan to be agreed on and for each participant to carry out his or her own specific function within the plan. The term collaboration usually evokes an image of a team meeting. This is unfortunate because collaboration is a process and the team meeting is only one of a range of techniques or mechanisms by which this process can take place. More broadly construed, interprofessional collaboration includes communication and coordination by means of consultation, unified record keeping, written data feedback, informal sharing of information and ideas, formal staffings, grand rounds, and other group of team meetings. This broadened concept of collaboration more truly mirrors the reality of the ways in which professional groups interact on a day-to-day basis. In many settings, the collaborative process is useful because it encourages a structure for cooperation, a culture for consultation, and development of consensus amongst professionals. It promotes the inclusion of all in planning and execution of services. Collaboration regularizes contacts with other professionals and secures their inclusion in the interprofessional group. Some group members have legally sanctioned functions that increase their power and authority. Others are more peripheral or are dependent on their colleagues' goodwill to perform their tasks. Personality traits as well as age, sex, socio-economical status, and racial or ethnic factors also contribute to the member's position within the group. The current situation. Historically, the nurse's traditional role was that of the doctor's assistant. In the light of many changes taking place within nursing, this role is now changing to one where the nurse's clinical expertise is becoming acknowledged, and nurses are developing their role as independent practitioners. The nurse's role as a member of the elderly care team is a multidimensional one as a facilitator of care, patient advocate, counselor, and the primary caregiver. In many ways, teamwork in the care of elderly people has developed from a more traditional approach with the consultant as team leader and decision maker, the other therapists and nursing staff contributing to the service at the request of the medical team. The combined expertise of the geriatrician and other medical staff, nurses, physiotherapists, occupational therapists, and social workers, together with many others, helps integrate strategies for monitoring treatment as well as planning short and long-term care for hospital patients. Research into the work of the hospital-based elderly care teams suggests that the rhetoric of the team approach to elderly care is central to the provision of healthcare generally and the elderly care in particular. Despite much criticism and skepticism, it is clear that professional staff who work with elderly people could not function effectively without an interdisciplinary approach. The success of elderly care teams, therefore, may at the end of the day depend less on leadership and more on the trust, commitment, and experience of those in it who need to acknowledge the contribution made by all its members. Mr. Salvo Abela is a 78-year-old widower. His wife died 5 years ago after 7 years suffering from Alzheimer's disease. Salvo was her main carer. They had 5 children, 2 of whom had emigrated to Australia. The eldest daughter was suffering from a heart condition which prevented her from properly caring for her mother. Salvo lives in the high-rise blocks of flats. The facade of the building boasted memories which have probably been lost to the past and indicate the previous tenants were well off. However, ever since the mass migration and the period of the Great Depression, the district became a slum area. Access to the building is via a series of steps. The general appearance of the area around the flat is one of filth with garbage bags overflowing and dirt scattered around. Parts of the walls are crumbling through and lacks paint. Salvo Abela's apartment is on the 3rd floor. To reach it, one had to walk up flights of stairs as there are no escalators. However, on entering the flat, one could feel the distinct touch of character. The place and bedroom were clean, and a small stove is used to warm the main rooms. He has a fine collection of religious statues. The lighting was poor. The neighbors volunteered the information that Mr. Abela rarely went out. Although he was always a reserved person, he became more so since the death of his wife. These neighbors used to cater for his shopping, and the local priest used to visit him quite often. Following the death of his wife, Salvo started to drink heavily, and neighbors have noted that he has become increasingly withdrawn and solitary, and now rarely goes out. One day the neighbors noticed that he did not leave the usual shopping note. Alerted by a degree of suspicion from the radio news of a few days ago, these neighbors called the police. On gaining access, they found Mr. Abela lying on the floor, unable to move. Salvo was still breathing, but was slightly cold, and he was unable to reply. Salvo was rushed to hospital, where he was diagnosed as having suffered a stroke with right-sided hemiplegia. Yesterday he was admitted to an acute geriatric rehabilitation center after spending 3 weeks at an acute general hospital. The conference room at the rehabilitation center. The team meets.
Okay, you can see me about that appointment later on. Hello. Hi. Hi. Here. Hi. How are you, Andrea? Right? You're tired? Nice. So, I think everyone's here. We can start the meeting. If I'm not mistaken, I was chairing last time, okay? And we were discussing the case of Salvo Abela, right? I believe his x-rays have been reviewed by you, Tony, haven't they? So can you let us have a background situation, please?
No x-rays have been performed since Salvo was admitted here. However, a number of imaging examinations were undertaken during his stay at the hospital. A chest x-ray was performed prior to being admitted to the ward, and this demonstrated a slight enlargement of the heart. The lungs were within normal limits. Would you like to see the x-ray?
Yes, please, Tony. Right, okay, thank you, Tony.
Also, a CT scan was requested, which on being performed confirmed signs of recent infarctions with slight edema. No hemorrhage, either intracerebral or subdural, was detected. No contrast agent was used, and follow-up CT scan was suggested within 2 to 3 weeks' time. Due to Salvo's history of alcoholism, an ultrasound of the abdomen was requested once his condition was stabilized. When he was examined, it was found that he has a relatively large left liver lobe and caudate lobe, with irregular borders indicating signs of cirrhosis. Salvo had developed pneumonia, which now seems to have resolved. The follow-up CT scan was performed within the recommended time period, and the well-defined infarct was noted. No other suggested requests were made.
Okay, alright, thank you, Tony. Right, Grace, would you like to tell us how you and your PAs are finding Salvo?
Well, yes. Following referral to our department 6 days ago, Salvo was assessed thoroughly. His main problems include inadequate bed mobility, inability to get to sitting and transfer, inability to bear weight and standing, and inadequate sitting balance. He is semi-independent in ADLs such as dressing and bathing. He can dress and undress his upper body, but he needs help in lower extremity dressing and undressing. All along, he requires physical demonstration and verbal prompts, as he tends to get confused. He still needs assistance during bathing, especially to transfer himself into the bath. But in bathing, he could be independent using his left hand.
That sounds like a whole battery of problems. I also heard in passing he had some feeding problems.
Well, yes, this has been a cause for concern. Salvo is now more able to swallow his food, but he needs to be observed for choking. Following up bathing and dressing sessions are being carried out by our OTAs, and treatment is being offered on a daily basis. He can now roll in bed to the right side and carry out bridging exercises. The latter are obviously important so as to help him with lower extremity dressing. Balance in sitting has improved, and he can now sit over the edge of the bed for 5 minutes without leaning towards the hemiplegic side. He's now able to get from lying to sitting adequately and using the right technique. There has been no return of voluntary movement in the affected upper extremity, and we are concentrating on inhibiting the spasticity that is setting in. Bilateral exercises for improving upper extremity movement have been shown, and Salvus will continue these exercises whilst on the ward. Oh yes, we are presently liaising with the speech therapist so as to improve his speech as he still is basic.
Sorry to break your flow of thought, Chris, but relative to what you have been saying, what do you think his home condition would be if we had to discharge him?
Well, a home visit will be arranged prior to Salvus' discharge so as to review his home situation and to prepare his potential carers for his discharge. It will also be useful to see what alterations need to be made in the home environment, and also which community support service can be offered to Salvo and his carers.
Okay, right, Chris, we'll see to that later on, right? Okay, Nikki, have you anything to add from the physio side?
Salvo's doing fairly well, in fact. Clarice was saying that his sitting balance is good. He can roll to the right, although not to the left on his own yet. The right side is becoming slightly hypertonic, especially in his right upper limb. His increased tone, however, can be controlled, and it is showing signs of improvement. He can now reach for an object in front of him with almost normal proximal synergies, although he cannot effectively grasp it yet. I'm working on that. I do, however, find teaching him difficult at times, since he doesn't always understand what I'm trying to convey. Clarice, I don't know if you found this.
Yes, in fact, I've noticed it too.
His span of attention seems to be very short, so we find that shorter, maybe more frequent therapy sessions can be more effective. His balance in standing is still poor, however, and this improves after release of trunk hypertonicity. We've started exercises to prepare him for walking, and I've been discussing positions in bed with Salvo's nurse, together with positions in the chair. We've also agreed on exercises between physiotherapy sessions so that Salvo won't forget in between during this time. If we keep up the good work, I think he should do very well. Yes.
However, do not forget that he is arthritic in his left knee.
Yes.
In fact, when he complained of joint pain and an X-ray was requested, this showed a decrease in joint space, together with the presence of osteophytes and osteoarthrosis.
Yes, I remember that, Tony, and that's important. Will you remind me to have a look at the X-rays again later on, please? Right, Manila, what do you have to say about Salvo's speech?
When he was in the acute hospital, we assessed him. However, since he is now neurologically stable, more complete diagnostic results are available. I feel that he needs an augmentative mode of communication in view of his verbal communication difficulties. Salvo also has hearing problems with hearing acuity not related to the CBA. We have had this confirmed by the audiologist. Naturally, this is aggravating his communication difficulties. Tests have confirmed that Salvo has some verbal receptive and expressive difficulties, and he also has a motor speech disorder. He also has reading and writing difficulties. He requires intensive help, but it is crucial that we get him the carer support to help him in the speech-language rehabilitation program.
Okay, right, Maria. We'll see about that also. Right, Maria, have you had any feedback from his family, or are they still not visiting at all?
Well, just to tell you the truth, I have only met his son only on one occasion. His son would like to make amends with his father, and he was quite happy to be involved in his care. The only problem that he is facing is that he does not know how to confront his father, his other two brothers and sister. In fact, I'm going to have an appointment next week with his son, but I would really like to have the nurse present for that appointment. For me, next week will be fine. I don't know about you, Andrea. Will you be on duty on Tuesday?
Yes, I'll be on late duty on Tuesday, so if you're trying to come about 4 o'clock.
So shall we put it on the diary?
Yes, I think you should.
Okay.
I'd really like to report back to you everything the nurses have been noting. I think we've been able to build up a rapport with Salva finally, although it took quite a lot of work. The nursing assessment highlighted needs for assistance with activities of daily living, as indicated by Nikki and also by Paris. And we've been working closely to coordinate his care. His water load score was 12 in nutrition, and his skin is healthy and intact. Fluid balance is fine, and yes, if you go through his past medical history, you'll find he's been suffering from hypertension for quite a long time. But now it seems to have stabilized at about 140/90, so that's really good, and his TPRs are also within normal limits. Nutrition. He still has to be encouraged to eat his meals, but his appetite has improved. He has some difficulty in swallowing, and he's tending to choke, so you have to be careful about that. There's also, yes, he also has a problem with incontinence, if you remember. That seems to be improving, thank goodness. And as for his constipation, that has been treated with lactulose, so we have to wait for the results. We'll see tomorrow. Regarding his psychological state, Sal was frustrated with his speech problem, although we have tried to work out a system using non-verbal as well as verbal cues. He doesn't always understand what you say to him. His mood varies and he tends to cry quite a lot. He also seems angry when he can't complete tasks, but he does try very hard.
Well, it seems as if he is having a difficult time of it all, doesn't he? Especially as he was so withdrawn when we were first introduced to him. Has he been able to make any friends on the ward at all?
No, not really. He doesn't interact with any of the patients, and he's only had 2 visitors since he came to us. One of them is his neighbour, Miss Camilleri. She's a real darling, and she's visited on a number of occasions. In fact, Maria, I think that Miss Camilleri, if Salvo and his son consent, would be of great help during the home visit. She does say that she finds communicating with him difficult, but he seems to enjoy the visits anyway, so I think that would do her really good if they'd agree. And also, his eldest son, as Maria pointed out, visited only once to inquire about his father's well-being. But from what I have seen, the signs of him are quite encouraging, and in fact, I think we may just be able to involve him and send him for personal support later.
Okay, thank you, Andrea. Right, we'll see about what we're going to do about that. Right. I think that all of you have given me everything that you have to. Right? Anybody would like to add anything to what we've just said? Right, okay. Right, thank you all for your contributions. It was a very fruitful discussion. If I can just sum up where we are with this patient, right? Okay, as you know, the chest x-ray showed he had pneumonia. This was possibly because he had been bedridden in hospital for some time. He has a speech problem and he still has difficulty swallowing his food. You should not forget that he was a heavy drinker in the past, and this has affected his liver to some extent, right? You always should take that into consideration. The main problem is with ADLs. That is weakness of the right side of the body, and his osteoarthrosis is not helping his general mobility at all. On the social side, he has relationship problems with his family. And coupled with this, we will all have great concern were we to discharge him to his home environment. Right, I think that is all we have to say. Right, shall we meet again in a fortnight's time? Right, shall we say around about 10 o'clock? Okay, is that fine with everybody?
Yes, fine, yes.
Okay, right. Right, so we can be discussing the next patient, and according to my notes, it's Mrs. Minster. I see. Clarice, you were chairing last time, am I not mistaken?
Yes, that's right.
Yes, okay.
Now let me start by listing some of the problems we will have to deal with in Mrs. Minster. First of all,
Okay, I think that we finished with that case, so, right. Thank you, Nikki, for sharing, right? Okay, so who do we have next? So it's Salvo Abela, I see. I think we've discussed him a fortnight ago, very quick. And if I'm not mistaken, I was chairing that case. Right, okay, so we were discussing problems related to his CVA, osteoarthritis, his liver condition, and his limited ability to carry out some of the ADLs, right? Okay, once again, I would like to hear some things from each one of you with regards to his progress this time, right? So, who's going to start? Will you start, Andrea?
Well, Salvo's mobility is improving a lot. The exercises the physios and the OTs have prescribed are being carried out with the help of the associate nurse, Frank. Yes, when we came to evaluate Salvo's care plan, we felt that one of our long-term goals regarding mobility has finally been met.
Yes, but do not forget his arthritis, which might hinder his mobility.
No, we're taking that into consideration together with the physio. His ADLs overall are also much better. He's quite mobile in bed, and he helps himself during bathing and dressing. His mood seems to have improved as well, and he has quite a number of visitors over the past few days. His eldest son George visits quite regularly, I would say, which is quite an improvement considering he was refused to see him only a couple of weeks ago. And his daughter-in-law Nancy has also been to see him. Probably that's why he's a little much better, but he still cries every now and then, especially when it takes him a long time to complete tasks which he thinks he should be able to do on his own. His eating pattern is perhaps not yet up to what it previously was, but it's also improving and he can swallow at least. In fact, when he was seen by the nutrition support nurse, she advised that the food be mashed. So we're starting on with semi-solid foods now, so Salvo will be able to swallow better. George and his wife know about this and have brought in some of his favourite food in semi-solid form, but it's nothing to semi-solid. We need to be careful about choking though. Yes, he still tends to do that. As far as vital signs are concerned, he has remained apyrexial, so there's no temperature there. His pulse is regular and respirations are within normal limits. His blood pressure has remained steady, leveling about 140/90, which is exactly the same as it was 2 weeks ago. He's tolerating his medications quite well as well.
Right, let me recap a bit about that. Is he on any antibiotics at the moment, or is there any other thing we're giving him, any aspirin or something?
Aspirin, yes. He is on aspirin, 75 milligrams daily. Also, we're continuing with his antihypertensive drugs and his diuretics. His urine output is quite good, and he's maintained urinary continence, and the lactulose seems to have worked because he's not suffering constipation problems anymore. Speech is still a problem, but communication has generally improved, and he seems to be able to understand what he's saying at least, which is helping us a lot. He can now answer yes or no to questions, and this is also of great help. The exercises that are being carried out by Mariella and her team seem to have helped quite a bit.
Yes. The dysphagia is generally improving, but dysarthria is still present, and this is causing some distress to Salvo and his family. I have met Salvo's family and advised them on technique to facilitate communication. I'd like to continue working with him. Will he be attending the day hospital?
Would you like to hold that query for a moment, Mariella? We'll come to that later on, okay? Thank you about that. Right. I would like to go to Nikki now. Nikki, what progress has been made with his walking?
Well, he's really determined to get back to what he used to be. These 2 weeks, in fact, he's achieved quite a lot. Andrew was saying that the long-term goals of walking are being met, and that is true. In fact, today he managed all the stairs with minimal assistance from ourselves. To both Salvo and ourselves, it seems that he's achieved quite a lot, and this is a remarkable improvement and progress in this aspect.
Well, yes, his motivation seems to have improved lately, and I think that's due to Maria's intervention on Salvo's family problems.
Okay, we'll be looking at that in a minute, Maurice, right? Okay, carry on, Nikki.
In fact, Maurice is learning much faster, I found, in these past 2 weeks, and his mood has improved, mainly because the family is visiting more often. His upper limb is functional to some extent. He can now grasp objects in front of him and place them basically where he wants.
Okay. Is that it? Right. Thank you, Nikki. Right, Maurice, you just mentioned Salvo's home conditions. Maria, what can you tell us about the family at his home situation?
Yes, sure. In fact, during the last few weeks, I've spoken to Salvo's eldest son a couple of times, and the last time also with the rest of the family. It has taken some discussion, but it seems that their father's stroke has reminded them that everyone is human, and they have decided to forget their past differences. At first, the sister was quite hesitant, but later on cooperated after the others rallied together. The general plan is that the eldest son, George, and his family are willing to take in Salvo after discharge, as long as they get some formal help for continuing rehab and management. And they stated that they will take it in turns to offer respite, and frequent visits will be arranged. George has 2 young children, and although they are quite a lively handful for the mother, they may make excellent company for Salvo. In fact, I think he has missed them quite a lot. So.
Yes, Maria and myself have been involved in discussions with Salvo and his family. who have visited quite a few times, as everybody seems to have noticed over here. They seem rather enthusiastic about Salvo's progress, and Salvo seems to appreciate that there is some way to go yet in the process of rehabilitation, so he's taking things step at a time now. Although it's difficult for us to understand him at times, he's conveyed to us quite clearly that his own flat has sad memories for him. He's happy that the family are rallying around him, and he's always that much happier after a visit by his family and his grandchildren. His neighbour visited too, and I think she's heard him quite a bit about him.
Yes, in fact, I spoke to Mrs. Camilleri some time ago, and she was very happy that relationships with his children have improved. And she also believes that his drinking problem became worse after he had lost their friendship.
In fact, yes, he hasn't had a touch of alcohol since he's been in hospital.
As I was going to say, also, Mrs. Camilleri also said that she would visit him if he's discharged to his son's house. During the last home visit, which was done in George's house, Salvo accompanied Nikki, Coris, and myself, and he seemed very happy with the environment. Do you agree? In fact, George's house is quite a suitable one, I would say.
Well, yes, I can support that. George lives in a terraced house with ample space downstairs. He's willing to convert one of the rooms into a bedroom for his father. There is a large backyard without steps and 2 steps just outside the front door. The small bathroom needs some alterations to permit safe bathing, and George is willing to proceed if we give him the go-ahead.
Okay, right. Okay, so let's have a quick review of the situation if he is going to be discharged to his son's home, right? Okay, how do you think Salvo and his family will manage, Andrea?
Well, together with the rest of the team, I've been talking with Salvo and George and Nancy, his daughter-in-law, about Salvo's nursing needs. So we've seen that Nancy has been helping us already with some of Salvo's hygiene needs, and we can arrange with the community nurse to visit daily for the first week when Salvo is discharged to help him with bathing and dressing. But I don't think there should be need for visiting after that. Initially, Salvo was slightly embarrassed that his daughter-in-law was going to bathe him, but I think he's come round quite nicely now. Anyway, if he continues to improve as he's doing, I don't think he'll need much assistance from Nancy or the associate nurse later.
That's good news, right? Okay. So, about his mobility, Nikki, what can you say?
Well, I don't think he needs any walking aids. In fact, he's walking alone and can perform transfers quite independently. I still, however, want close supervision from the staff and from the family if he is eventually discharged back to his home. I've been working with George, in fact, his son, and teaching him how to support his father whilst walking and transferring him onto the bed or to the chair, and so on. And this is not because Salvo is unable to do it by himself, but it's just for safety purposes. Generally, the problem is still the increased toe on the right side. However, he's coping rather well, and if therapy continues for a few more weeks, I should say he'll do very, very well, and he should really improve.
Well, I agree with Nikki, and as Andrea suggested, Salvo can now address practically on his own. Dexterity is still lacking, which makes buttoning and tying shoelaces difficult. There are a number of ways around that problem, and I have shown both him and his son the necessary aids that have to be purchased to help in his activities of daily living. As Nikki said, Salvo can walk. His balance is good, but sometimes he shuffles his right foot and trips. I thought an ankle foot orthosis could prevent the problem, but Nikki
I just believe that it's too early for this sort of thing. I mean, we've been working on him for so long, and the altered gait caused by the orthosis will increase muscle tone, and that means losing all the normal movements that we've gained so far.
Okay, all right. Well, I think we all have to rely on both of you, right? Come to a conclusion between you, whether you want Salvo to be fitted with a 90-foot orthosis or not, right? So you will see to that totally. Right, okay. If you think that Salvo will benefit from it, you can request a consultation with the orthotist, okay?
Yes.
Right, okay. From the social and nursing side, it looks as if we'll be able to discharge Salvo soon, right? We need to consider his further rehabilitation with that regards. I think he would be an ideal candidate for the day hospital, wouldn't you think? Do you think he will have any problem getting here, Marietta?
No, I don't think that will be a problem. We can always arrange transport for him.
Yes, and also the day hospital will give us a chance to continue rehabilitation, and will involve the community team for his discharge, and as he becomes independent, then we can finally involve the family as well.
Well, I'd like to continue to see him at the day hospital. I have talked with Salvo's son and wife about techniques to help in communication. Sal was working very hard on this aspect, and it would be a pity to halt progress now.
I think the hospital will benefit both Salvo and his family with that regards. It will serve the family as a respite and give us all an opportunity to maintain contact with him and monitor his progress. By the way, Tony, we need to give him the result of the second ultrasound, don't we?
Well, no second ultrasound has been requested. Only one ultrasound was performed, and that was when he had liver problems. Does this mean we want a second ultrasound?
Yes, it would be useful to repeat the ultrasound. I thought we had requested one, Tony. Okay, right. By the way, are there any other x-rays performed on his knee and joint pains?
No, the presence of OA was detected in his knee joint, and this was very much compatible with his age.
We'll have to see about that also, Tony, right?
Salvo does say that his tablets are helping with his joint pain.
Andrea, can you let me see his medication chart, please? Is it available here?
Do you mind if I give it to you later? Because it's
Alright, okay, it's okay, it doesn't matter. I just wanted to ask you, is he still having lactulose and about his bowel movements? Are they okay? Is it
No,
okay
his
with that
bowel
part?
movements are fine, I think I mentioned it earlier. No, we're not giving that to those anymore, but he still is taking a soft diet.
Okay, I understand.
Still finding it difficult to swallow.
Okay, Andrea, we will continue him on a daily dose of aspirin, right? And he needs to be maintained on his antihypertensive and diuretics, right? Can he swallow them, Andrea?
Yes, we don't need to crush them now.
Right.
Taking that in.
Okay.
Oh yes, we have had talks with Salvo and his family about the importance of taking his medication, and they've worked out a checklist for this. As you see, he's on a multivitamin suspension as well. We've told him when he needs to take it, and he seems to have understood. I'll check with him at the end.
We do need to remember the needs of Salvo's carers, right? And this is going to involve a big change in their lifestyle, so we all have to think about that. Are there any more ways we could think of helping them or anything else?
Yes, in fact, as Andrea has said, the community nurse will be helping the family in the early stages. And as far as finances are concerned, we are going to contact the Commission for the Handicapped. The Social Security Office is also to be contacted to see what government funding we can get under the relevant legislation for them to pay for the necessary alterations to his son's house. As Salvo is registered as a permanent disabled person. In fact, we have also contacted Telecare, and they will have a line available soon once they receive the formal application. In fact, the papers are in the file, Charles.
Okay, right, that's
The thing is that he may miss his neighbor, but Mrs. Camilleri has said that she would visit him if he's discharged from his son's house.
Also, the day hospital will help us keep an eye on his progress. And due to his age and history, we can include him at the at-risk register and review him periodically. It should help the family if they know this as well.
Okay, good queries. We need to give them all the help that we can take from at the moment, right? Okay, good. I think we have made very good advances at this stage, right? It certainly has taken a lot of teamwork, but I see that we've all worked together to arrive at this point. Right, just for our records, I'm going to just sum up the main points. From the medical point of view, after hearing your views, I think Salvo is ready to be discharged, right? Medically, we need to continue the antihypertensive, diuretics, and aspirin, Andrea.
Yeah.
Due to his drinking problem, we will continue to monitor this, right? We'll see if there's going to be any relapse with that regard. And Tony, don't forget that during his first visit at the day hospital, the results of the second ultrasound needs to be given to him, okay? Right, Andrea, would you mind to remind the houseman to draw up some blood for the repeat LFTs? Right, is the problem? No. His cholesterol and urea are still elevated. So, however, his drinking habits may prove to be less of a problem. Okay? So, the main problem are still the residual effects of the CVA and right hemiparesis. Okay, the main problem are the residual effects of the CVA and right hemiparesis. He has regained his balance to an acceptable degree. His mobility has improved greatly, and he will continue with his medication for his joint pains. Right, and Nikki and Coris, you will remember to resolve the issue of the autosis. Right? As I'm seeing from my notes. Yes, okay, yes. His chest has now cleared up, has no cough or sputum production. Right? On the social side, we have satisfied ourselves that his son is willing to offer alternative accommodation and that Salvo has expressed a willingness to go there, and that the family are eager to assist in his rehab. Right, Maria? Andrea, could you let everyone, please, once again, here have a brief summary of our notes with notations of what each member of the team has to do? Okay. And will you also see to it that the necessary discharge notes are prepared for when he's ready to go home? Thanks for your help, Andrea. Okay, now, can we move on to our next case?
Yes,
see it's Mrs. Lister.
Yes, next on the list is Mrs.
The
Lister.
ball is in your court.
If you remember, we also discussed her